Welcome, bienvenidos to the 1347 podcast. In this episode, we'll address the role of data in detecting healthcare fraud. Okay, let's get it. A few extremely important disclaimers on this topic. This episode is not designed nor intended to replace the knowledge of the data scientist or data professional. I'm well aware of the brilliant subject matter professionals on the topic and many who are my friends and whose role is invaluable in the world of healthcare fraud detection. This episode was created for the beginning and or intermediate level analyst, auditor, compliance officer, claims reviewer, and or investigator who does not have a strong background in healthcare fraud detection or data analytics. In full disclosure, my area of expertise is criminal investigations. Therefore, my bias will be from that perspective as we navigate through this episode. Data terminology can be complicated and varied, and I will try to keep the discussion in lay terms for the most part and to level set this conversation where we are examining the proactive approach and utilizing data to detect healthcare fraud and abuse. Okay. Goal number one, identifying your data repository, or where does the raw or unadjusted data reside. Well, what does that mean? Raw or unadjusted data. It just means the primary source of the data and data that has not been processed or scrubbed. For federal entitlement programs such as Medicare and Medicaid, the data custodian will be the Centers for Medicare and Medicaid Services, or CMS for short. The Medicaid data custodians is contained at the appropriate state Medicaid agency. There are a myriad of contractors that represents both CMS and some state agencies as the clearinghouse data custodian. Please keep in mind that depending on the sophistication of the data repository, the data you receive most likely will not be real time, and there's going to be a lag time that varies from agency to agency and clearinghouse to clearinghouse. Goal 2, manage the data in creating a review plan. Please have a trusted coworker review your plan and provide input to offset any built-in biases. Once the data is received, what are you looking for? First, aberrancy in billing, or what service is being billed. Second, acute spikes in billing, a sudden increase. Third, decrease in billing historical deviations. And fourth, established provider versus new provider. Remember, all of the above may have an explanation and it may not necessarily be suspicious or fraudulent activity. Always, always, always test and retest your assumptions. Goal number 3, building your case. Remember, data has its limits and it's only part of the picture. You'll need to develop an extended snapshot of the business or provider to include who owns the business. What are the affiliated companies, if any? Identify the day-to-day operators. Identify the financials. And lastly, test your assumptions. Goal number 4, identifying the time period of possible fraud or suspicious behavior. Is this an ongoing issue or has the activity ceased? Are they still at the location? Are they open for business? Are there customers at the location? And lastly, test your assumptions. Goal number 5, be logical. Remember, logic is the study of correct reasoning. Not every review is the poster case for fraud. Abusive billing does not necessarily equate to fraud. Okay, a quick summary of the 5 goals of data utilization. Number 1, identify your data repository. Number 2, create a review plan and manage your data. Number 3, build your case. Number 4, identify your time frame. And number 5, be logical and always test your assumptions. Big shout out to the Texas Oversight Nation and all the great questions we get each week from our subscribers. Thanks to the 1347 staff who work tirelessly to ensure my job is seamless in producing this podcast. If you found the content of this podcast useful, please let us know by dropping us a line at info@texasoversight.com or subscribing to our group at texasoversight.com and following us on Twitter at Texas Oversight. Lastly, please remember, when your passion meets your purpose, great things will happen. Peace.